All right, a very good evening. I'd like to be able to welcome you to another of our Health and its Preservation with Dr. John Clark. Before we begin our study this evening, I'd like to be able to invite you to bow your heads for a quick word of prayer. Our Father in heaven, we want to thank you for this opportunity and the privilege that we have to be able to study these truths together. We know there are many things, dear Lord, that we don't realize what we do to our bodies, but we thank you for these messages that can come clear to show us the way in which we can be able to live, so that our minds are clear and receptive during these final hours of this world's history, so that we can hear that still small voice speak to us. And I ask you once again that you would be with your manservant, that you would put your words in his mouth, that we can be able to hear the messages that you have ordained for our salvation. In Jesus' name we pray. Amen.
Yeah.
Um, in my reading this morning, I found this quote in Desire of Ages, chapter 3. We're told that Satan was exalting that he had succeeded in debasing the image of God in humanity. I thought that was interesting. It's Satan's studied plan to be able to remove the image of God in humanity. And I think in all that's happening around us, I mean, we see a lot of light that's coming out. We see a lot of evidences portrayed as to how much of this is going on in the background. But we are grateful for the fact that we have an opportunity to study these truths. Dr. Clark, thank you again for being here. May the Lord continue to be able to bless you, your ministry, as you begin our series today. Go ahead, sir. This time is yours now.
All right, I'll start by sharing my screen. And there we go. Go here to my. All right. I was doing a meeting, and the lady came up to me afterwards, and she says, "Dr. Clark, how do I shrink my liver?" Now, I'd never had a question like that before. That was puzzling to me. And so I started asking some questions. I said, "How do you know that you need to shrink your liver? Why do you want to shrink your liver?" She says, "Well, Dr. Clark, I was in an automobile accident a couple months ago. And when I was in that accident, they took me to the hospital. And part of the medical care was to do a CT scan on my uh, torso. And when they got done, she says, I asked the tech that had done my scan if everything looked okay. And he says, "Well, I'm not the radiologist, but from what I've seen before, it looks pretty good, except that you have a swollen liver with a ruffled border." Oh, now she's worried. It's an unusual finding. Swollen doesn't sound good. A ruffled border? What's that all about? So she says, "Well, what? Why would my liver be swollen, and what gives it a ruffled border?" And the tech sort of backpedaled and said, "Well, I'm not the radiologist, but I see it in people who take vitamins for their eyes." She says, "You mean like Ocuvite? I take Ocuvite." He says, "Yeah, that's one of them." She says, "What should I do?" He says, "Well, I can't tell you what to do, but if it was me, I wouldn't be taking that stuff." Well, now she'd come to me and said, "How do I shrink my liver?" Well, that's very fascinating. That was my first exposure to toxic substances causing liver damage and swelling. We're going to talk about fatty liver disease this evening. You might have it, you might not know it. And sometimes it's abbreviated NAFLD. Oh, what's NAFLD? Non-alcoholic. See, a lot of fatty liver disease or cirrhosis is from alcohol. And this is really cirrhosis that's caused by something other than alcohol. So non-alcoholic fatty liver disease. And so we're going to talk about pathophysiology, diagnosis, treatment. It's also known as metabolic dysfunction associated steatic liver disease. Oh boy, what a mouthful. Just think of it as fatty liver, okay? We'll just call it fatty liver or enlarged liver. And so that's what we're going to talk about. And whereas my lady that I illustrated this with got it from taking a vitamin pill that had substances in it that weren't very helpful, um, we're going to talk about other causes. That's probably not the main cause. That's that's just one cause. And so key points we're going to talk about is most common cause of chronic liver disease in the developed world. Quite a lot of liver disease, in fact. Slated to be the primary indication for liver transplant in the next decade. Why do people get their livers transplanted? Well, nowadays it's more from a fatty liver than from perhaps hepatitis C or B. And then non-alcoholic fatty liver disease is associated with increased overall mortality. People die. What do they die of? Well, usually it's cardiovascular death. But this has to do with the fact that the liver isn't doing its job. And what really happens is you get advanced fibrosis. And this is what leads to death and liver-related mortality. And that's really what cirrhosis is. So really fatty liver is a type of cirrhosis. I used to treat people fairly conventionally. Here's one of my patients. But now I do lifestyle medicine. Our goal is to maximize your health above the probability of disease. We want to keep you healthy. And fatty liver is one of the things we need to keep you from. The global prevalence, in other words, how many people right now, today, have this is 30%. 30% of this world's population have fatty liver. Now, that's like 1 in 3. So start around the room, start counting. 1, 2, 3, you've got it. 1, 2, 3, you've got it. 1, 2, 3. Wow, it could be you. It could be 30%. That's a pretty high percentage. And I mean, around the world, it's worse in South America than it is in North America, but it's all around 30%. Europe and Asia, 30%. And genders, there's more men than women. This is interesting. And so keep that in mind. 36% men and 25% women. 1 in 4 for women and 1 in 3 for men, or a little more than 1 in 3 for men. And so if you're obese, though, and remember, the United States, that's 2/3 of the population. If you're obese, 57% chance. Over half of obese people have fatty liver, okay? So keep that in mind and hark back to our obesity discussion. And this is the final outcome. Obesity isn't just, extra fat around places, it's in the liver too. Now, it's increasing. In fact, in the last, few years, we go from 1990 to 2006 compared to 2016 to 2019. We're looking at a 50% increase. So this thing's going up. More people are getting this, and it's worldwide. I'm not just talking about the United States. This is worldwide. Worldwide prevalence. And so, it parallels the obesity and metabolic syndrome, insulin resistance, diabetes, central obesity, hypertension, high cholesterols, and so forth. So if your cholesterol's up and you're carrying extra weight, think fatty liver disease. Now, here's the way the progression works. The fatty liver, so there's a picture of your liver. So here it is behind me too. Here's the liver, and first it starts out with steatosis. What's steatosis? That's just fat accumulation. In other words, more than 5% of the hepatocytes get too much fat in them. That's not very much, 5%. Then the steatosis ends up going into inflammation. And that's where we get non-alcoholic steatic hepatitis. Hepatitis meaning inflammation. And then you get ballooning of the cells. They fill up with fat. They look like bubbles. And then from inflammation turns into fibrosis. And that's just the additional thing between NASH, non-alcoholic steatotic hepatitis, Um, it's hepatic inflammation. Um, and then from fibrosis, you go to cirrhosis, and it becomes non-reversible. In other words, what happens is the scarring becomes so thick and so fibrotic that there's no returning back. There's no reversing it. It's sort of a soft call where that is, but and then after that you can get tumors. I mean, that's where cirrhosis goes to, is to tumors. So this ends up in cancer, okay, and this ends up in liver transplants, and this ends up in well, we'll talk about symptoms as we go along here. So morbidly obese people, I mean, uh, especially people coming for bariatric surgery, get their stomach tied up so that they don't eat so much. 90% of them will have this. Diabetes, 60 to 70%. Metabolic syndrome, 53%. Dyslipidemia, in other words, too high cholesterol, 50%. And they're in this particular article, they're saying that men are twice as apt to have it as women. And then if you're Hispanic, there's a higher prevalence. And I sort of showed that there originally, but this one here in 2015 is showing a little more. Signs and symptoms. Well, sometimes you don't know, and that's why it can be sneaking up on you, just like high blood pressure. And but when they do get symptoms, they get fatigue. Oh, I'm tired all the time. They don't feel well. They have malaise, which is kind of like the flu. Pain or discomfort in the area where the liver is, and this would be sort of where the liver is. And itchy skin, itchy for no good reason at all. Abdominal swelling, also called ascites, with fluid around the organs. Shortness of breath, swelling in the legs, that's especially from the inflammation. Spider-like blood vessels just beneath the skin surface, here and there and everywhere. Enlarged spleen. I don't know that you would be able to figure that out on your own. It's sort of a physical examination finding by a doctor, but an enlarged spleen is not a good thing. Red palms. Oh, palm your hands red. Yellow skin or eyes. We call this jaundice. Now, we say you are what you eat. That should give you a clue what might cause a fatty liver, right? Not that you're eating fatty liver, although eating fatty liver wouldn't be good for you, but eat fat, okay? Fat of any source or anything that increases inflammation. So really, flesh foods. Flesh foods are the biggest source of fat on the planet. People eating flesh foods, it causes a stagnation in the liver. It plugs up the blood vessels. Eating the flesh of dead animals has an injurious effect on spirituality and liver health. So it affects the brain, affects the liver, affects all kinds of things in your body, your risk of cancer. If you have a high meat diet, high total meat intake is associated with a 76% higher risk of fatty liver. So think about that before you eat that stuff. Uh, and you thought you got extra energy from that meat? Well, the extra energy is soon going to be gone as you go into fatigue with fatty liver disease. So it's not going to be a good long-term energy boost. And what about organ meats? I said you are what you eat. What happens if you eat organ meats? Well, people who eat organ meats, such as eating liver, have a higher risk of fatty liver disease. It just makes sense, doesn't it? And organ meats, as much as they're touted by the industry as being good for you health-wise, they're not. The liver's the filter. Can you imagine eating the filter on your car after you change the oil? It's black. You don't want to do that. Well, that's what the liver is. It's a filter, and it filters a lot of fat. So that's why you end up with fatty liver disease. So just think of it. Just spices and grease, you trans fat, saturated fat, fried fats, cooking oil, they inflame the liver, and they lead to fat deposition and degeneration. This is the source of fatty liver. You are what you eat. So what you really want is a plain, simple diet composed of whole grains, vegetables, fruits, prepared without spices and grease. It's much more healthy for the liver. That's what you want. We go to eating too much fats these days. Um, yeah, we have a whole talk on fat. You can see it on my website, but yeah, on fats and what happens. Now, speaking of fat, full fat dairy. Full fat dairy is like, yeah, whole milk, but also like cream or cottage cheese or all kinds of cheeses, some yogurts. Um, Frequent consumption of non-skim milk and full-fat dairy increases the risk of fatty liver disease by as much as 2/3. Well, but I thought milk was healthy for me. Well, it doesn't turn out to be so, okay? It doesn't really turn out to be so. You aren't a baby cow, and I mean, over time, milk isn't as healthy as it used to be, and we're seeing these increases in diseases. But let's get back to meat. What is the fat in meat? Well, it's saturated fat. Saturated fat is especially dangerous for the liver. Consumption of saturated fats, these are long chain and short chain fatty acids, predisposes toward hepatic fat, fatty liver. And so this especially comes when you're eating too many calories, which is usually fat. You mean fat has 9 calories per gram, whereas sugar has 4, alcohol has 6. So it's usually, fat that's going to give you these hypercaloric diets. But they generally increase the fat accumulation in the liver. On the other hand, hypocaloric or caloric restriction diets decrease fat in the liver. So if you can eat more fresh fruits and vegetables, that's the best way to have a lower fat consumption, okay? So now both long chain and medium chain. Why do I mention medium chain? What do we have pictured here? Coconut oil. Coconut oil is no different than lard in causing fatty liver. Much as people like to tout how wonderful coconut oil is, it doesn't turn out that way. And so coconut oil and things like margarine and trans fat, those are bad news. Trans fat makes the liver inflamed. What's trans fat? Well, when they try to hydrogenate vegetable oils, when they try that hydrogenation process, they end up making twisted fats. It's really a double bond that is in a different conformation than usual. So cis fats are when you have a double bond here, represented by my thumbs, and you have the two side groups coming off on the same side. When you get trans fat, one of them turns upside down, and so it's twisted at the double bond, and you end up with, I mean, so much for chemistry. It comes from frying fats, it comes from hydrogenating fats, it comes from heating oils, and yeah, is butter any better? No, butter consumption is associated with higher mortality from cancer and chronic liver disease. So that's not, and why do I picture here? Where's the butter in the picture? Did you know croissants are layers of wheat flour and butter? And it's bunches of layers of them. There's just massive amounts of butter in a croissant. But butter, people use butter in cooking, people use butter in uh, oh, frying things, and they put it on their bread and so forth. Fried foods definitely accelerate liver fibrosis, leading to cancer. You see, we're not just talking fatty liver here, we're talking the next steps, right? Fibrosis. So when you go for those fried foods, a lot of people go for a breakfast of fried bacon and eggs. A lot of people go for deep fat fried things like French fries and onion rings. And I mean, this stuff's dangerous. Fried foods are four or more times per week increase the risk of this fatty liver by 120%, more than double the risk. Now, oil and vinegar harm the liver. So what we have is we take a salad, a perfectly good salad, and we take a dressing that is a mixture of oil and vinegar. I mean, Thousand Island Ranch dressing, blue cheese, whatever. They usually put vinegar in it. When they put vinegar in it, and you have the fats, then this causes fermentation in the stomach. It causes liver and kidney difficulties. You get inflammation and you're in trouble. So first you get fermentation, then you get decay, then you get putrefaction, which is oils that are going rancid. You get dropsy and liver complaints and trembling nerves. You get feverish, unbalanced mind, almost delirious. You get dyspepsia. We must be satisfied with pure, simple food prepared in a simple manner. Adulterated substances, which we're talking about here, oil and vinegar, are to be avoided. And so I'm talking 30% of the population. You know, some of these things just astound me. We see cancer going up, surpassing heart disease, the number one cause of death for Americans. We see liver complaints, you know, fatty liver going up 30%. I mean, and everybody, I mean, think about how you're going to die. My wife is especially careful to avoid things that cause cancer because her mom died of cancer, her dad died of cancer, her stepmom died of cancer, and so she's pretty worried. So she does the things to avoid what causes cancer. Well, does everybody do that? Well, they should, right? So oil and vinegar definitely harm the liver. See, vinegar is metabolized in liver, such as it is what it can be metabolized, and it increases liver cancer. And it also increases bladder cancer because it also goes out there. And so we're talking stuff here that's part of the problem. And people eat it in all kinds of things. You think where we find vinegar. Vinegar is in breads. Vinegar is in condiments. Vinegar is in pickles. Eating pickles, which have been cured in vinegar, which most of them have been. You can get lemon juice pickles, but most of them are cured in vinegar. You have a fermented product here. It significantly increases the risk of developing fatty liver. But those things don't have any fat. Yeah, but they cause inflammation. And part of the fatty liver is the inflammation. Another thing that will do it is indulgence of appetite. When you overeat, overeating clogs the liver. Indulgence of appetite as compared to temperance and self-denial produces a dyspeptic stomach, a sluggish liver as it gets all plugged up with fat, and a clouded brain to go with it. Anybody want a clouded brain? Hopefully not. So the vital powers are exhausted in throwing off the excess food. The liver is burdened, being unable to throw off the impurities of the blood, and sickness is the result. The liver and kidneys become diseased. Less food would have nourished the system, and its powers would not have been taxed and overworked. The gastric juices works on the amount that the system can assimilate, and the surplus remains undigested to decay. You wonder what happened to the extra food you ate? It decays, making the breath offensive. You ever have bad breath? And causing a disagreeable taste in the mouth, especially when you get reflux. So now, obesity leads to inflammation, which triggers fatty liver. When you have that extra fat, as this gentleman is grabbing hold of here and showing you, it is hard to attend to all that fat. Some of it starts to be what we call um, rancid, or go into a very, what would we say? Well, I'm sort of fishing for words here. I want to paint the right picture here for you, because as the chronic obesity triggers a prolonged inflammatory response, this leads to fibrosis, organ damage, and multi-organ dysfunction and failure. And it's because of these rancid fats coming out of big fat cells that aren't attending to their fat very well, and you end up with trouble. All right, so don't let all this excess food scar your liver. Overnutrition taxes the body's anti-inflammatory resources. It uses up all your antioxidants. And most of the time, this food is not got lots of antioxidants. Like this gentleman here is eating stuff that doesn't have antioxidants. he's going to end up with a fatty liver if he doesn't already have it. Well, how about low carb? Maybe I should go low carb. Maybe, South Beach diet, paleo diet, Atkins diet, and, all these different diets. And shall I go low fat? Should I go, high fat, low carb, high protein, low carb? No. Fatty liver is associated with the increased consumption of these low carb diets where they have lots of protein, usually of animal source, high total fat. They usually have soft drinks and snacks along with it. They often tell you to eat too often. And on the other hand, you have a lot less fatty liver when you consume complex carbohydrates and dietary fiber as found in a unrefined carbohydrate diet. So not all carbs are created equal. It's one thing to eat sugar, it's another thing to eat an apple, okay? The lady here is comparing her stack of donuts to an apple. If she eats the apple, she is not going to end up with fatty liver. She eats those donuts, man, you're going to get fatty liver in a hurry. So high refined sugar intake together with lower complex unrefined carbohydrates, right? Yeah. So people eat sugar, the donuts, and they end up with less fiber. Those donuts don't have fiber. It's all been taken out as white flour, and so they have an increased risk of dying of their fatty liver. Replacement of refined processed sugars with complex carbohydrates, like the apple, like carrots, like green leafies, like whole grains, with good fiber. These have long-term health benefits that help reduce the risk and even can be how to start reversing your non-alcoholic fatty liver disease. Now, there's certain sugars especially bad. Fructose sweetened products increase the risk of fatty liver by another 10%. And it's because the fructose inflames the liver. If you remove all fructose sweetened products from the diet, you reduce the risk significantly. People's favorite source of fructose is usually carbonated beverages. Just 4 per week increases the risk of fatty liver by 47%. It's the fructose. It's the fructose. And plus, you're not drinking good water. You're just, drinking these sodas. Is there an advantage to low carb artificially sweetened drinks? Well, increased risk of fatty liver by the amount consumed. Notice if you drink about 1 a week, then you have a 43% chance, a higher risk of fatty liver. You consume 1 to 2 liters per week, and you end up with a 73% chance of fatty liver. And then you go over 2 liters per week, and a lot of people do. You end up with a 137% risk increase for fatty liver. It's all kinds of things to it. Why 30% of the world's population with this problem? Well, everybody's drinking sodas for sure. Now, another thing that does this, you use these sodas along with monosodium glutamate, MSG, and you end up with more problems. This really increases the problem. Monosodium glutamate actually induces dyslipidemia. Oh, what's that mean? It messes with your cholesterol and your triglycerides and your insulin resistance. And then you get high fructose corn syrup mixed with that, and you're definitely got a prescription for fatty liver. So how do I get fatty liver in a hurry? MSG and high fructose corn syrup, or high fructose. Wow. Where's another source of high fructose? Agave nectar. So if I use agave and Bragg's liquid aminos, there you go. You got some stuff to give you fatty liver. Now, another thing is people using lots of oils, bottled oils. Here's a gentleman squirting bottled oil in a stir fry, probably sesame seed oil or soybean oil. Soybean oil is more detrimental to fatty liver than high fructose corn syrup. Okay? We just talked about high fructose corn syrup, didn't we? And how if you're drinking 2 liters of high fructose corn syrup sweetened sodas per week, your risk of non-alcoholic fatty liver disease goes up by 137%. Now we're saying soybean oil is worse. Okay, soybean, and if it's GMO, and most of soybean oil is going to be from GMO, and they can tell by testing the bottle of oil where it came from. GMO soybean oil causes congestion, necrosis, and bile duct hyperplasia in the liver. It really melts down the liver. Whoa, man, where are you going to find organic soybean oil? And yeah, that's sort of a contradiction of terms almost, right? That's like, yeah, let me get some organic pork. Mm, yeah, right? How about eating between meals? Ooh, now you're stepping on toes. Unhealthful snacks. Yeah, late eating causes more dyslipidemia, more high cholesterol, and more liver disease. With snacking between meals, the liver becomes inactive, the blood impure, and people get sickly. They get irritable because they're suffering from intemperance. Sweet cakes and sweets cause injury to the stomach and liver. Coffee, tea, spices, and seasonings are risky for the liver. Well, what should I eat then? When you leave the fresh fruit and vegetable section of the supermarket, you're on uncharted territory. You're on dangerous ground. You're really going where the spell is. And so you get to, when you eat these things that we're talking about here, between meals and snacks and sweet cakes and so forth, you end up with dehydration because you don't drink as much water when you drink those. Baking soda issues inflame everything, acid in the stomach, inflammation in the liver, and you're on your way. I mean, these snacks definitely make your liver fatty. And it has to do with the fact that they're usually oxidized oils, especially. And so it doubles your risk of fatty liver, especially in adolescence. So think of all those kids going to school and getting fed fried foods and snack machines in the lobbies and hallways, and processed food and processed people. Here's a lady reaching for a box of cereal, believe it or not. And consuming processed foods increases the risk of fatty liver by 26%. Frozen meals, TV dinners, soft drinks, hot dogs, deli meat, fast food, packaged cookies. Oh, there goes all the cookies. Cakes, salty snacks, jarred sauces. What are jarred sauces? Barbecue sauce, Worcestershire sauce, sweet and sour sauce. Box cereals. Box cereals, yeah. Let me get a drink of water here. I know this sounds like a lot of bad news, but we're going to get to the good news eventually here. How about salt? 60% higher risk of fatty liver when you have a high salt intake. It inflames the blood vessels, inflating their liver. How about third meal? The third meal a day, if taken at all, should be strictly confined to simple food, or we will reap the consequences in disordered digestive organs, clogged liver, and disturbed bowels. And so eating an evening meal increases the risk of fatty liver by 25%. You don't need that third meal. Or if you do eat it, it should be largely fresh fruit. Stimulants, coffee, tea, they're all bad for the liver, causing an increased risk of liver problems. Mold exposure. Clean those dusty corners in our dwellings. Make sure your bathing area is free from mold. Food is an abundant source of mycotoxins. People eating more mycotoxins in the form of mold, like here on this cheese, or in foods that are fermented, and we did a whole talk on fermentation, you're going to have fatty liver. Most drugs are metabolized in the liver, putting you at higher risk. Yeah, the liver, heart, and brain are frequently affected by drugs. And so amiodarone, a heart medicine, aspirin, ibuprofen, AZT for AIDS, protease inhibitors, valproic acid, carbamazepine, and so forth, tamoxifen, methotrexate, 5-fluorouracil, glucocorticoids, it's like steroids, prednisone. Um, these are all bad news. The list, I mean, that's such a small list. Don't get the idea that's at all an exhaustive list. Probably most livers, most most drugs are metabolized in the liver or go out through the kidneys. And so if they're going through the liver and they're hitting the P450 enzyme system, you're going to be in trouble. Overclothing the skin. So you have insufficient fresh air and your sweat ends up returning back in your body. This makes it so your liver and kidneys and lungs all have to get rid of those toxins that otherwise would have been gotten rid of by your skin. And so be careful how you dress. You don't want to underclothe and you don't want to overclothe. And you want to be evenly clothed. So clothing has a lot to do with this. Air impurities harm the liver. Especially, here's somebody trying to get a job in a stable. And the comment is made that with his poor liver, he shouldn't get a job in a stable because the impure air there is going to cause him great difficulties for his liver. So just breathing bad air. I mean, how often do you eat? 2-3 times a day, hopefully at most. Well, how often do you drink water? 3, 4, 5 times a day. How often do you breathe? Oh boy, you're breathing 18 times a minute often, at least 15 times. And so yeah, that's all day long. And so what you breathe in has a lot to do with your health. So what you want is fresh air. The prevalence of fatty liver is higher in urban districts. We're talking where people are crowded together in cities. On the other hand, people out in rural districts where the air is purer have less fatty liver. And so you want to get out and away from the busy highways, the busy populated areas, out where there's less people. Indoor life produces liver invalids. You see, they don't get their fresh air. A lot of families, they live indoors. They don't keep their windows open at night. They rebreathe the same air. They're going to end up with more liver problems, more lung problems. And so they need to learn to get fresh air, to keep the windows open, to breathe deeply. And that way they'll have a better tone to their liver and kidneys and lungs. When you go outdoors, you want suitable clothing. If your feet are not well clothed, the blood is chilled back from your feet, and you end up with more inflammation of the liver, inflammation of the whole body. You see, whenever the blood comes back cold from an extremity, it inflames the closest organ. For men, that's the prostate. For women, it can be lungs or breast. For men, it can be lungs if it's the arms. So proper clothing is important for the liver because the circulation changes that happen with cold extremities ends up making the blood all stagnate and inflame in the chest, abdomen, pelvis. You also don't want compressive things around your waist. The circulation is clogged and inflammation results, and the liver is burdened by compressive clothing around the waist. So a tight belt, corsets, bands around the chest. Thus, insufficient supply of oxygen is received. The blood moves sluggishly. The waste poisonous matter, which should be thrown off in the extremities from the lungs, is retained, and the blood becomes impure. Not only the lungs, but the stomach, liver, and brain are affected. And when we talked about cancer, we mentioned the bra being a cause of women's breast cancer. Well, here's some of the mechanism. Now, self-abuse. What's self-abuse? Masturbation. Self-abuse harms the liver. Yeah. And so you end up with fatty liver disease with such practices. Mental health state. So people who gossip, who get depressed, gloominess, sadness. It's interesting here. I'm just going to read this. She need not linger long, as she does, always sick, if you will all as a family heed the instructions given of the Lord. What's the instructions? He that will love life, y'all love life, hopefully, and see good days. Yeah, we all want to love life and see good days, have good life so we can love it. Let him refrain his tongue from evil. Well, what does it mean to use your tongue for evil? This is gossip. A contented mind, a cheerful spirit, is health to the body and strength to the soul. Nothing is so fruitful a cause of disease as depressive gloominess and sadness. Mental depression is terrible. You all suffer from it. The lungs contract, the liver is inactive. And so it all started with a wagging tongue. When you wag your tongue about others, you get depressed yourself, gloominess and depression and sadness, and you end up with liver problems. Now, the mental state of sadness has the effect to affect the liver. Sadness deadens the circulation of blood vessels and nerves and also retards the action of the liver. So if you're sad all the time, you could have a sad liver. Despondency and discontent make you have an inactive liver. Lamentation says, mine eyes do fail with tears, my bowels are troubled, my liver is poured out upon the earth, for the destruction of the daughter of my people, because the children and the sucklings swoon in the streets of the city. And so here's Jeremiah lamenting how awful it is in Jerusalem and how the state of the people is, and it's affecting his liver. Fascinating. Yeah, mental state. So people who are having difficulties mentally. You have dwelt upon the thought that you were not well, but feeble and exhausted and nervously shattered, until this has become a fixed thing with you. You brought it on by believing it. Your ailments and poor feelings are more in consequence of your own thoughts and your diet and lack of physical exercise than the settled disease. Your system becomes clogged, your liver inactive, and the impurities are not thrown off from your system till nature, which is still strong, makes her voice heard in remonstrance, by pains and aches, that she may rid the system of accumulated impurities that are warring against health and life. Stress increases fatty liver. Insomnia increases fatty liver. Computers and mobile devices, when you use them a lot, 3 hours a day or more, increase the risk of fatty liver disease. And people wear these things. I mean, I should put together a talk on mobile devices and EMF, and I mean, it's just crazy what these devices can do to you. Excuse me. All right, how about smoking? Well, tobacco products. We're talking cigarettes or nicotine. And we have some supposed medical missionaries suggesting nicotine for COVID and that kind of thing, or trying to cure everything with nicotine. Well, they didn't take into consideration that they're going to end up changing the disease from whatever to fatty liver and yeah. Another thing that does it is toxic herbicide exposure. Roundup, 2,4-D, weed killer. This stuff causes fatty liver disease, and everybody's got a little Roundup in them. It's in just about everything. Toxic chemicals from vinyl chloride, plastic seats, and so forth. The risk of NAFLD goes up by 80%. Flame retardants, perchlorinated biphenyls, PCBs, and pesticides. We're talking increased fatty liver disease, and it's just wow. There's a reason why 30% of the world's population has this. Now let's compare total vegetarian diets and omnivore diets. Notice the omnivores are the line that has no breaks in it. Vegetarians have a dotted line, and vegans have a dashed line. Who has the best results here? Baseline at 6 months. And we're looking at two parts of the liver, the hilus and lobe 6 of the liver. Notice that in either case, the vegan diet drops the fatty liver disease, whereas the vegetarian diet barely does, if anything, or does nothing. Why is that? Because a lot of people who are vegetarians eat a lot of oils. And then notice that the non-vegetarian diet definitely increases your cirrhosis of the liver, fatty liver. So take advantage of all the healing properties in fresh fruits and vegetables. Eat lots of them. And this decreases NFLD. So vegetables decrease the risk by 22%, fruits by 12%. Good fruits that help are things that are high in vitamin C, like kiwi. Things that are low fat, like lettuce. Switching from a Western diet to low fat or Mediterranean diet can reduce the fatty liver disease by as much as 32%. And it improves the liver enzymes. People get these high liver enzymes. We're talking, high alkaline phosphatase and so forth. Fiber's good, like oatmeal fiber or oat bran. And so it's the beta glycan, and it feeds healthy bacteria. It lowers the NFLD, or the fatty liver. Nut consumption, especially, like we're pictured here, nuts that you have to crack yourself, or fresh nuts, in other words, unroasted nuts. Eating 4 servings per week can reduce the risk of fatty liver by 5%. Consuming nuts 1 to 6 times per week in another study can decrease the risk of progression to advanced fibrosis by 45%. So it helps stop the progression. Caloric restriction, eating less food, leads to weight loss and loss of fat in the liver. The fat goes down throughout the whole body. And so this is very important for people who already have it or are starting to go toward fibrosis. These low-fat, caloric-restricted diets are going to help. No specific dietary intervention has proven more beneficial than caloric restriction for reversing non-alcoholic fatty liver disease. So what are we saying? Go with 80% fresh fruits and vegetables in your diet. 80%. And the other 20%, make sure it doesn't have refined foods, processed foods, oils, and that kind of thing. Now, we've talked about chrononutrition, chronobiology, circadian rhythms. Irregularity in meal times, when you're throwing food at the liver at irregular times, and irregular sleep times cause circadian clock disruption, metabolic disorders, and they result in more fatty liver. You want to eat on time. Get on a schedule. Always eat breakfast at a scheduled time, 7 days a week. Always eat lunch at a scheduled time, 7 days a week. There's certain herbs that are helpful for reversing fatty liver. Hawthorn berry tea is a good one, and this is very, very helpful. Turmeric, supplementation with curcumin or turmeric improves liver fat and transaminase levels in patients with fatty liver. Helps reverse liver damage. It's a super antioxidant. Exercise is a great blessing. By active exercise in the open air every day, the liver, kidneys, and lungs also will be strengthened to perform their work. Physical exercise. This helps to cleanse the blood and the liver. Activities of life. Physical exercise is a precious blessing for both mental and physical ailments. Exercise with cheerfulness would, in many cases, prove a most effectual restorer of the complaining invalid. Useful employment would bring into exercise the enfeebled muscles and would enliven the stagnant blood in the system and would rouse the torpid, which is plugged liver, to perform its work. So start being more active. Exercise your way to liver. So, for example, each steps increase, approximately 10 minutes of walking, reduces the risk of fatty liver by 12%. And we usually recommend getting 10,000 steps, so that's very helpful. Sunlight lowers fatty liver. Sounds like we're going through 8 natural doctors, doesn't it? Well, you got it. We sure are. Sunlight increases vitamin D and lowers inflammation and fatty liver. So, just to reiterate here, physical activity. Liver-related benefits of exercise. It improves the insulin sensitivity, decreasing the liver lipogenesis, or the liver making of fat. See, the liver will make fat out of things so it can be stored, like sugar. Reduction in visceral fat. So it makes it so that there's less fat accumulating around the organs. Increased hepatic clearance of the very low density lipoprotein. It helps to make it so you don't have the problem with those more dangerous um, cholesterol subfractions. Vigorous activity, what's it do for you? Like we're talking 75 minutes per week. It reduces fatty liver by 35%. 150 minutes per week, and you reduce it by 47%. So the more active you are, the longer you are active, the better the result. Aerobic exercises versus anaerobic resistance training both reduce the fat in the liver. And so you don't need to decide which one to do. Either one, both, they're both good. A bath is good for the liver. It soothes the nerves, it promotes circulation, and it helps the liver. It gives you more energy. Remember, we said people with this problem have less energy. It helps the energy. Charcoal absorbs toxins, it absorbs fats and carries them out of your body. It reduces inflammation in the liver. You can take it orally. You can make it into poultices. It can be used in many ways. And so charcoal's a big benefit. In summary, as the refined processed Western diet spreads worldwide, so does the associated lifestyle diseases. Fatty liver disease is helped by focusing on a healthy diet and lifestyle. Eat for strength and not for drunkenness. What we want is pure air, sunlight, abstinence, rest, exercise, proper diet, use of water, trust in divine power. These are the true remedies. Focus on fresh fruits and vegetables, and watch that fatty liver melt away. So you can find resources on our website, especially the cholesterol talk, which we go into how to lower your cholesterol, and the inflammatory foods talk, otherwise known as our fermented foods talk. Study that one. Our obesity talk, study that one. They're all there on my website. Most of them are links to this channel. So there you go. Very good. So I'm going to stop sharing the screen, and I'm going to go back to the Zoom. There we go.
Thank you, Dr. Clark. Um, are there markers that we can be able to identify that we have fatty liver? Uh, Probably some common symptoms that we see. Um, how do we tell that we have it?
Yes, so usually it shows up when somebody goes to the doctor and he orders a metabolic panel. A metabolic panel includes three, four, 5 different enzymes from the liver, and the one that's often goes up, if I remember right, is alkaline phosphatase. At least the most recent fatty liver patient I dealt with had a high alkaline phosphatase, and the rest were just marginally high normals.
Are there any layman's symptoms that we can be able to look for?
Well, yeah, certainly. If you're gaining weight, you know that you're of high risk. And then if you have fatigue, then you know that that's a sign that it's advancing. If you feel pain over there in your liver area, then that's sort of something to be aware of and think about. Um, it's it's almost like hypothyroidism. It's almost like diabetes. I mean, all of them can cause fatigue and obesity, and but if you have these other things, these other risk factors, diabetes, high cholesterol, even hypertension, then asking your doctor for a liver panel just to check it out would be a way of doing it. I mean, if you're getting really serious about it, then they'll do a liver scan with a CT scan, If they think you go into advanced stages, they'll do a liver biopsy, stick probably a percutaneous needle biopsy core sample, and go look at it under the microscope, and that'll tell them for sure. But there's telltale signs on CT scans and MRI. MRI is probably going to tell you a little more than a CT scan, but they're they're correlating pretty good with their radiology reports on correlating between what different livers look like on CT scan, on what level they have for their stage of really cirrhosis from fatty liver.
Interesting. Um, was doing this weekend with the young people at the church a presentation with regard to depression and mental health and anxiety. And this has become a big issue for us because we've actually had this quite close to home for several of our church members. Um, but I found it real interesting that you would mention that some of these hits for liver disease actually show up in depression and anxiety that we were looking at with Dr. Nedley's material. And it's real interesting how some of these are correlated with the other. And even the treatment protocols are pretty much the same. And looking at how you mentioned how forgiving the liver is, that if we should be able to stop the abuse almost immediately, the liver jumps back to life and helps to be able to bring about that healing. Um, Dr. Clark, would I know you did say that we've dealt with obesity and how to be able to deal with losing weight. Would you be able to reiterate a few pointers? Would intermittent fasting and how we can be able to do it work in a practical sense for some of us who have struggles trying to be able to do this uh, on the road?
Yeah, certainly. And it's in America and the Western countries, there's certainly an increase in weight. And as we export our Western diet to the rest of the world, the weight is also going up in the rest of the world. Oh, excuse me just a second. I grab a drink of water here. Gotta keep my hydration up. So key points for losing weight um, include things like eating at the exact same time every day, eating a good breakfast. People who eat a good breakfast tend to not gain weight. People who eat after 3:30 p.m. End up packing most of their food on as weight. So talking about intermittent fasting, good intermittent fast would be to always skip supper. Fasting 1 day a week is good too. You can start off with a extended fast if you want to. Although a steady weight loss is usually more sustained than just plain fasting till it's all gone. Um, Other things that are very helpful are eating foods that are high in fiber because they provide bulk in the stomach. They provide bulk in the duodenum. It ups your satiety hormones. It helps regulate your ghrelin and your leptin, and so those are very helpful. High fiber. Eating food that is not processed. The more you process it, usually the more calories it has, the faster you can pack on the calories. Eating more of your food raw instead of cooked tends to increase your energy and your vigor without giving you weight gain. That's very good. Another important part of weight loss is drinking extra water between meals, or even drinking water right up to your meal. I've been studying this. Usually in the past I've said wait 30 minutes. But in reviewing what we're told in Inspiration about this, uh, she recommends drinking even a pint of water almost right before you eat of warm water. And it's like, wow, that's a lot. But if you drink that much water, you've just filled the stomach with something other than food. And so it's the displacement phenomenon helps to It's a stomach staple. Just drink, put something else in there. Other things that are beneficial are avoiding the things that trick you. Things that trick you and drive you to eat more are oils. So we're back to the oil thing. When people eat more oils, it drives food consumption. That's why the Greasy Spoon restaurant's still in business. Put oil and sugar together, and I've sort of experimented with this and thought, okay, if I'm getting toward the end of my meal and I'm feeling sort of full, but maybe I'll have some almond butter on a date. I ate that, and all of a sudden, oh, I could have another one of those, and I could have another one of those. And I'm thinking, no, I'm not having another one of those because, yeah, it's a trick. What happens is it reduces your satisfaction signals to your brain, and all of a sudden you get hungry again because of the effect of the sugar and the fat together. And so beware of that. There are certain foods that just drive food consumption because they are um, chemically going to do that. MSG, superfood. When you eat out, I don't know. I don't eat out, but when I'm forced to, you try some of the food. Almost all of it is loaded with MSG. I don't know of any restaurants out there that don't have a lot of MSG. Oh, they hide it. They hide it under other names. Industry is especially found that they call it yeast nutrients because yeast is high in MSG, that they can, still get their super flavors in there and drive food consumption. Because people eating MSG eat quite a bit more than those not eating MSG because there's like a wow in every bite. Animal products because they're high in fat and they hit the morphine receptors in your system, so animal products will drive more food consumption. Um, and then there's the whole thing of self-control. and and in my obesity talk, I give the illustration of a doctor started giving his patients a prescription that had the Bible text on there. Was it 1 Corinthians 10:5, whatever? There's no temptation taking you, but such as common to man. But God is faithful, not allow you to be tempted above that you're able, but will with the temptation make a way to escape. And having his patients look at that about the time they're about to take the next serving of food, and saying no. And yeah, but so the other thing, looks like I have a mosquito flying around here. The other thing we talk about is having a a good eye for foods that are high in volume and low in calories, so that you are always eating a full amount volume-wise, but it's not going to be high calorie. And I always give the illustration of a Snickers bar versus a head of lettuce. The head of lettuce is going to have very few calories, but it's going to fill you up. The Snickers bar is not going to fill you up, but it's going to be loaded with calories, and you can have another one and another one and another one. And I've had people tell me, yes, I ate 12 Snickers bars at one sitting, and well, that's not going to help your weight. So yeah,
Oh,
I guess Norma's too good of a cook.
yeah,
I know that from personal experience.
yeah. Thank you, Dr. Clark. Yeah, I was looking at something else that was put out in an article with liver scarring as such. They said that starvation, severe starvation, leads to steatosis through various mechanisms. Uh,
Oh,
so I'm wondering, is the opposite side, the flip side of what we are trying to be able to achieve, also something that we worry about as well? Uh,
oh, never came across that. I'll have to look that up. That would be an interesting thing to see what mechanism is going on there.
yeah,
Um, you can only speculate, but food is stored in the liver as glycogen, and then if you run out of glycogen, I guess you got a very, you know, reduced liver. I don't
sure.
know if that's part of it, but we could only, think about what might be causing that.
Mm.
Um, the other thing that happens in starvation is you go into ketosis massively, and that's usually mediated by the liver. And the ketosis it has its benefits, but also has its drawbacks because ketosis you can be tipped more toward an acid environment, um, and ketones themselves, they're not. I don't know. You couldn't really live permanently on ketones, and so like we said, the low carb, high fat, high protein diets lead to non-alcoholic fatty liver too. So there you go into ketosis and that. So maybe it has something to do with ketosis.
Yeah, I was looking at something about with regard to severe surgical weight loss procedures, like the bariatric procedures that you mentioned about, that also would lead to conditions of where now they're not doing it out of the right reasons type thing. So there's no change in diet, there's no change in the type of food that they're eating, and they have a similar sort of a situation develop, a certain complication in that regard.
Interesting.
Yeah. Anyways, Dr. Clark, thank you very much for your presentations. I didn't see any questions that came in from anyone. I don't know if anybody has a question. We only have one sister who is online. I know that there are 8 people who are watching on YouTube. I don't know if they have any questions. Um, I didn't see anything that popped up there either. But those of you who are watching, I'd like to be able to let you know that Dr. Clark is going to be talking about oils and our next presentation. So that's something to look forward to on October the 4th. Please come back where he'll be talking about the ultra processed foods. And specifically, he will be dealing with soybean oil, aka the vegetable oil. So we want to be able to come back to be able to listen about what we can do and how to be able to avoid stuff that all of us have taken for granted. Dr. Clark, before you go, would you be able to comment? I know we don't want to be able to get into politics here, but with what's been happening in regard to identification of the various types of vaccines and things of that nature that people are kind of depending on to be able to keep them healthy, so as to say. And with all that's happening right now with our comments put in blast with regard to what the new Secretary of Health has to be able to say. Uh,
Well, you'll have to enlighten me. What's he saying about vaccines?
well, if at all anything, he's not a someone who is a pro-vacciner, but he's someone who does talk about allowing people to make those choices. At the same time,
Right, right.
yeah, he's allowing people to be able to come to a clearer understanding of where it is that big pharma has their clutches, and it's associated with big foods as well. So we are seeing that a lot of people are beginning to understand that there is a correlation between disease and what they eat and their lifestyle as well.
Yes, okay. Now I understand what you're talking about. And, prior to him getting into politics, at least not politics, but into Trump's cabinet, he did sort of cast himself in the media as being anti-vax, and was on a lot of the national talk programs that discussed this, along with some other famous anti-vaccine people. And so it's very interesting, that that's coming into politics. Certainly, the arguments that they would come up with, that they would talk about, would be efficacy arguments. And that's all they're interested in, at least. And for the big pharma, they try to fake the efficacy so they get on the payroll of the government because the government will pay for these kind of things. And but from a Christian standpoint, we say no to vaccines because of their violation of principles in Leviticus, where God says that if you're going to get contaminated with disease, which that's what vaccines are, you have sinned, it's iniquity. You need a blood atonement to pay for having done that. and you need to repent and return to good health practices. And if you don't, then you get cut off from your people, which means it's a test of fellowship. So it's a test of fellowship. It's a salvational issue, and uh, and so we don't participate in those kind of things from a biblical point of view. If that makes sense.
No, absolutely, Dr. Clark. Thank you again, Dr. Clark, for your time and your ministry has been a tremendous blessing for us. If you do have any closing comments about non-alcoholic fatty liver, we'd like to be able to hear them now. And if you can close us out after that with a word of prayer.
Yes, as I started out with my talk here, I kind of was broadsided by this lady who took, vitamin pills, and that would be a toxic substance. And we're exposed to so many toxic substances, which the liver ends up having to deal with. And I guess I should mention, things we use to cleanse our liver are cruciferous vegetables like broccoli, cabbage, cauliflower, kale, those kind of things, and thistle family things like milk thistle. And if somebody really was in liver crisis, we might be doing hot and cold treatments over the liver. We might be doing charcoal poultices over the liver. I did mention that. And and then the whole lifestyle program that we would use for somebody with any degenerative disease, which is the 8 natural doctors, we would certainly be pushing those. And on that chart, we showed where you go beyond the point of no return. So there's quite a few stages. There's like 3, 4 stages before you go to the no return. And so if you come back with a diagnosis of fatty liver, work hard to get it reversed because it's still reversible in most cases. And if it's going to fibrosis, I'd be eating pineapple because it's fibrinolytic, or taking as a herb King of Bitters, which is fibrinolytic. Um, and so the Lord provides us with natural remedies that help reverse these things that happen to the liver. All right, well, let's bow our heads for prayer. Dear Father in heaven, we're thankful that you love us, you care about us, you've given us a lot of this health information. Many of our slides here tonight were straight from your inspiration. And we know that you have a way of teaching people the right way because you want us to be healthy, happy, and holy. You want us to feel good. You came to this earth and you went through towns, and when you left the town, many times there was no sick person left in that town. And you did it to show how much you care about people and you want to reverse the pain and suffering that sin and Satan have caused in this world. Lord, we pray that we'll be a part of that team that will reverse pain and suffering. We're doing it through education. Other people are doing it through natural remedies, and that's great. And we want to be a part of that process of restoring human beings to the divine image that we can be prepared both physically and spiritually for your coming. And we thank you in Jesus' name. Amen.
Amen. Thank you again, Dr. Clark. Um, those of you who are watching, if you'd like to be able to uh, get to know when we are going to be going online, I'd like to be able to have you subscribe to our channel. You can be able to see every time we go online, and we do have other like Bible and various educational material that comes out on this channel for our studies, and you can be able to receive that notification. We are looking to be able to do um, a week of prayer, so as to say, but it would be more a health evangelistic perspective in the month of November. So stay in tune for that as to when it is that we can have Dr. Clark come back to be able to do a whole week-long study of health and its spiritual conditions. Until we have an opportunity to meet again, may the Lord bless you and keep you and love you so that you can be able to be in health even as your soul prospers. God bless you, and thank you again, Dr. Clark, for this phenomenal study, sir.
Amen. Thank you.
God bless.